I think first and foremost the important thing to me was it was set at a time that suited me. It was lunchtime. I'm not particularly a morning person, so if they said it's going to be 9 in the morning, I wouldn't have been overly pleased. And I thought, but it's not that long towards the end of the day where you've got too much time to get nervous, but it just gave me enough time to sort of pace myself to get up in time and read through some final notes and that sort of thing, made sure that I'd got myself to the venue on time, knew where to park and had plenty of time. I find that's a good way I cope with nerves, is to plan quite sort of rigidly as I go along, so I know I've got plenty of time. It took place in the Department of Epidemiology and Public Health in the Clinical Scientist building at City Hospital, which was where my internal supervisor is based, and she would have been happy to come to QMC, but she said she'd prefer to be there, and I was quite happy to go there. I've been to that department before. I know where to park, I know the system, I know where the building is. Although it was a new extension to the building, I knew how to find it. So that in itself was quite reassuring to know that I wasn't running around QMC trying to find a room or whatever. I dressed formally, put a sort of shirt and tie suit on. That was just something I think it wasn't. I think somebody did say, "You're not going to wear your football shirt, are you?" Because I'd spent 4 years wearing football shirts in the department, but I did say no, I'm going to wear a shirt and tie suit. Obviously, I think it's important that you go looking as professional as possible. I got there in good time, and when I arrived, I knocked on the supervisor's door, the internal examiner's door, and she just said that they were just in the process of preparing for me, so if I just want to go and sit in the research office down the corridor. And that was quite good, because actually when I went in there were a couple of people I knew, and it was quite nice just to sit there and just talk generally. I had taken my thesis with me and some other documentation. I'd done some qualitative research, and I'd taken some examples of how I'd coded my interview data and some of the quotes I'd drawn on, because I hadn't actually put those in the appendices at the time, and I suddenly realised that's something I would like to have in the appendices, so I took those with me just in case they asked about them. So I suppose I was in the waiting for about 20 minutes, but I felt reasonably relaxed because I'd just been diverted by just chatting generally to other people about the things, really. The room was a circular table, quite a small office. I was, what the external supervisor was next to me on this side, and then the internal was on the opposite side of the desk, and felt quite compact. It didn't feel like it was sort of shouted across a large open space, which was good. I can't remember, I was introduced to the external examiner, although I had met him, sort of seen him previously. I hadn't actually been introduced to him before. I remember the first thing I saw, the internal examiner had lots of little post-it notes sticking out of her copy of the thesis, and they said, "Don't worry, that doesn't mean there's anything wrong, just because she's got hundreds of these sticky notes sticking out of this." So that was sort of a humorous style. That was pretty much the opening section. And then one thing they did actually say to me, "This is probably only going to take about an hour," which certainly put me at my ease, because I'd heard horror stories of people being in Vivas for 3 or 4 hours, and that sort of immediately made me think there mustn't be anything particular that they found in it that's of concern to them. So that was, I thought, quite eyes-opening.